Welcome to the nursing process. This is where we're going to start to think like a nurse. This is part one, Introduction to the Nursing Process. The objectives we have for all 6 parts of this PowerPoint presentation are: identify the components of the nursing process and critical thinking, discuss the concepts of the nursing process, utilize the nursing process when providing care to culturally diverse adults with an emphasis on the older adult, and develop a plan of care for an adult geriatric client. Before we can discuss the nursing process, we have to look at critical thinking and get a better understanding as to why nurses must have critical thinking skills to care for their patients. So what is critical thinking? Well, it can be described many different ways, but it basically means to objectively analyze and evaluate an issue in order to form a judgment. Critical thinking is deliberate and usually occurs to reach an outcome or a conclusion. There is research that shows that some people are born with critical thinking skills, always seeking the truth in things, and others are not. Some researchers say that people without critical thinking skills cannot be taught how to critically think. I personally do not believe this. I do agree that some people are born with critical thinking skills, but I also believe that over time, people can develop these skills. The skills people need to be able to critically think include being able to identify and interpret information or issues gathered by the data, take that information and analyze it, make explanations for why the issue is occurring, and evaluate the thinking. Critical thinking also involves a lot of self-reflection and flexibility in thinking. Sometimes you have to bring past experiences into your thought processes, and sometimes you need to consider alternatives for what may be occurring. Nurses use critical thinking all day, every day, in all practice settings. It's the foundation for clinical reasoning and clinical judgment, which is what we'll talk about in the next couple slides. In nursing, it takes time to develop. It's a skill that must be practiced day in and day out. Nursing school is not a knowledge-based program. You need to know the information, of course, but you're expected to take that knowledge from nursing classes and your prerequisite classes and apply that knowledge to real-life situations. That's why we have clinicals, skills days, case studies, and we use evidence-based practice. We need to help you develop the ability to critically think to save lives. Nursing involves a lot of trial and error and still does. Sometimes we try something, we test it, and if it improves outcomes, we continue doing it. So nursing is very scientific. We're using the scientific process you learned in 5th grade. We're using it every single day. We just call it something different. Nursing is also very intuitive. We use our experiences, our backgrounds, our background knowledge, and our gut feelings to think through situations. And sometimes we have to be very creative with our thinking. I like to say nursing school and nursing books are very black and white, but the people we care for and their diseases are 50 shades of gray. Clinical reasoning and decision-making is a process used to think about patient problems in the clinical setting. It's a way for nurses to make informed decisions on care that focuses on the patient's outcome. Clinical reasoning and decision-making also follows the nursing standards, policies, ethics, and laws that surround nursing practice. We don't focus on an outcome that are out of our scope of practice or legal. This process is patient-centered. Everything we do, every goal we set, is all driven by the patient we are caring for. We use clinical reasoning and decisions to identify our problems, issues, and risks occurring with our patient, and we use logic and intuition and creativity to come up with goals and solutions. The ultimate end goal is to take our critical thinking and clinical reasoning and decision-making to develop clinical judgment. One thing about nursing that you need to know is that our profession is full of amazing nurses who figured out a lot of ways to help us think, act, and practice to be the best nurses we can be. One of those people was Dr. Christine Tanner. She is credited with the Tanner model of clinical judgment, which is a way to help nurses critically think. Tanner's theory included 4 parts: noticing, interpreting, responding, and reflecting. Noticing is the initial grasp and perceptions of the situation that are impacted by context, the nurse's practical experience, knowledge of expected versus unexpected data, ethical perspectives, and the nurse-patient relationship. Interpreting is attributing meaning to that data we just collected and noticing it through multiple reasoning patterns. Responding is deciding on an action or inaction and monitoring the outcomes. And reflecting is about us looking at our actions and seeing how the patient responded to them. Tanner had a lot of great ideas, but nursing is a scientific profession, and as such, we have our own scientific method called the nursing process. The nursing process can be called ADPI or ADOPI or sometimes API, but those three names are basically the same thing. I'm going to break them all in depth as we move through the PowerPoints, so I'm only going to do a very brief overview here. Assessing, or the first A in ADPI, API, ADOPI, is systematically collecting our patient data. We're doing our assessments. Then the D would be we diagnose to identify patient strengths and actual and potential health problems and needs. Then we're going to develop a plan of individualized care that specifies the desired patient goals and related outcomes and the nursing interventions most likely to assist the patient to meet those expected outcomes. Lastly, we execute the plan of care by implementing our ideas, and then we evaluate the effectiveness of the plan in terms of patient goal achievement. Did everything we did in the nursing process make the patient better or worse? So I mentioned the NCSBN in our first set of PowerPoints, and they are the overarching organization that tells the state boards of nursing how to regulate us, but they also create our NCLEX, that test we have to take when we graduate nursing school. So to make the NCLEX, the NCSBN took Tanner's theory, some clinical reasoning and decision making, and the nursing process and created the clinical judgment model. Some of you may have friends or relatives who have mentioned this, as it's been affectionately referred to as the next gen or the next generation NCLEX. The next gen NCLEX started using the clinical judgment model as a way to evaluate nursing students' ability to critically think. The nice thing about the change to the clinical judgment model is it uses the same way nurses have been thinking for many, many years and gave it a new name with some new terms. As you look at this incredibly confusing picture on the right, I'm sure your brain is freaking out, wonder what you were getting yourself into. Don't worry, we all thought the same thing when it was announced that nursing schools would go to this next gen. But when we break it down and we look at it step by step, as we will do over the several PowerPoints, it will start to make a lot more sense to you. Just look at the bottom row. Those terms, those are the terms that we're going to be using. We just discussed how nurses critically think and the crazy way we got to clinical judgment model, but let's look at it a little bit more in depth and a little bit more clearly. The basics of everything we do as nurses follows the nursing process. It doesn't matter if we call it clinical judgment model, ADPI, ADOPI, API, we're all following a scientific process that helps us critically think our way through our patient care. The nursing process is a very circular process, even if the picture on the right looks like a colorful snake. We are doing this process over and over all day long while we care for our patients. Sometimes our best laid plans don't work and we start all over again, and sometimes our plans work great and the patient gets better. I'm sure you all really want to know what the difference between ADPI, ADPI, and API are. Well, they're the same things. But in ADOPI, outcomes identification and planning got their own letter. So ADPI is ADOPI with outcomes getting its own letter. API is a little different. This is exactly like the D step in ADPI or ADOPI. This nursing process removed the letter D because nursing has its own diagnoses, or that D diagnoses, but they're not universally used in the country. So not every state uses ADPI. I know it's confusing because your fundamental students learning the basics of everything, we will be using that D, that diagnosis, in this course. The P, the I, and E in API are exactly the same as the P, the I, and E is ADPI or ADOPI. NCLEX likes API the best, so it used API and Tanner to form the clinical judgment model. Block 1, we really like ADOPI and clinical judgment model because it's the best for you fundamental students trying to learn the basic steps of the nursing process. So we will kind of be using ADOPI and clinical judgment intermingled. Following the nursing process is the foundation of everything we do. It's not just because it's something we've always done or because we say so. We do it because it's evidence-based, it's time-proven, and it allows the patients to have the best results. For the patient, the nursing process allows for holistic and individualized care. It's completely patient-centered. It also allows every nurse to follow the same plan of care, which also helps save the patient time, money, especially if they're hospitalized. For us nurses, the nursing process allows us to work collaboratively with other team members. It allows us to see the patient improve and get better, which is the most rewarding part of being a nurse. And it allows us to grow professionally because we need to do research on treatments, medications, and options for our patients. So the NCSBN took everything we just talked about, critical thinking, clinical reason, decision making, the nursing process, Tanner, and added a little bit of spice and developed the steps of the clinical judgment model. So the clinical judgment model follows the same processes we discussed and changed the names. Instead of ADPI or ADOPI or API, we have recognize cues, analyze cues, prioritize hypothesis, generate solutions, take action, and evaluate outcomes. So let's take a look at how the clinical judgment model fits in with API, because like I said, they took Tanner and API. So assessment and recognizing cues are the same thing. Do you see how they're both red? Analyzing cues and prioritize hypothesis are the same as analysis. They're both yellow. Generating solutions is the same as planning. They're both purple. Taking action is the same as implementing. They're both green. And evaluating outcomes and evaluation are the same, and they're both blue. So we have two things that are almost exactly the same with different names. But like I said, it's the exact same thing. All of this pretty colorful little slide right here is our scientific method. This is our scientific method of using clinical judgment, critical thinking, and making clinical decisions to affect our clients' needs. This is the end of introduction. What we're going to do from here on out is each PowerPoint section is going to be focused on one specific part of the nursing process.